clean right now, man. But I got symptoms though. This motherfucker full blown. You alright, bro? Tell them how you feel, man. Huh? You alright? Bro, you alright? You want me to go get the police? Huh?
No.
What have you done, this bitch?
You ain't gonna do nothing about it.
I don't want you down in here on me though, baby. You dead? How you breathing? You alright? Your breathing alright? Alright. Yeah, this shit for real, bro. I ain't even playing. I can't. Now, like Soraya just said, she think I should get away from her. I can't get away from her. Where the fuck am I gonna go? Like, you know what I'm saying? All these motherfuckers in this bitch dying. Like, literally. 3 people died. AI, motherfucking Woodrow, and some other dude. You feel me? I'm like, fucked. Then, you know? I don't know if it's like me or what. It's like I'm breathing all crazy and shit. You know what I'm saying? Then they hit us with these little masks and shit, man. But shit, I don't know what the fuck to do on some 100 shit. I'm just trapped. And Loops, Sherry, Grandma, and Adrian, and Harper, I love y'all. If this shit, like, you know, if this shit go left, I love y'all. I swear to God I do. Y'all the best thing that happened to me since cocoa butter. You're my everything. But I'm in here, man, you know? Ain't shit I can do. Probably eat in a minute, you know? Gotta go wash my hands. Hold on. But yeah, no. I don't know what to do, man. Shit. Damn. Oh, let me tell y'all this shit. Oh, hold on. I'm about to show y'all something. So, you know, everybody in the unit got this shit. Probably except like 3-4 of us, right? This is what they gave us. This little ass thing of soap to stay clean, like wash our hands and shit. And this for every 2 weeks, like literally. And then how they got everything set up is to protect the COs from getting affected. You know, it's like no protection for the inmates. But hold on. Let me show you. Yeah, you know, it ain't no protection for the inmates. They don't care if you die or not. They literally letting you die, and that's it. Like shit. They gonna throw you in that tent I showed y'all, then they gonna be like, hit your parent, tell you he called Corona and wasn't nothing we could do about it. But it was something you could do about it. You got the CARE Act and you got the fucking compassionate release. You feel me? I meet the criteria for all of that, by the way. You feel me? Why am I still here? Somebody need to answer that question. For real. But, you know, if I don't make it, LHJJ, you was my nigga. Straight up, you was my dog. If this thing turned out left, you was my dog, LHJJ. You know who you is. For real, but shit. I don't know what to do. So I'm about to shit. I'm about to get up out of here in a minute, man. I got disinfected, you know, that's all I can do for real, disinfect this shit, you know, but other than that. Hold on. Yeah, man. They literally letting motherfuckers die, hold on. Huh, what happened? That's one of the dudes that ain't got it either and shit. And he meet the criteria too, so why we in this bitch, you feel me? That's my word, they got a law. Like, if you ain't got it, you can go home on home confinement. Then you got to think, I got less than a year left. Why am I in this bitch? You feel me? But, you know, I'll let Stevie Wonder, man, you know. I can't figure this shit out. You know? And then Then they talking about half the unit supposed to die and shit. That's what the nurse said. He was like, be prepared. There's about to be a lot of deaths, and it ain't nothing we can do about it. I'm like, man, that shit crazy. So look, like I'm telling y'all, share this shit, bro, to anybody. Try to save my life, shit. And the few of us that ain't got this shit life, for real, for real. Share this shit, motherfucking. Hit up whoever you can hit up, you know. Do me a solid. Cause I can get up on home. They want the money on some bullshit, you feel me, dog? On some bull, cause they can send me on home confinement and I can pay to be on home confinement. That's not really a problem. I can pay for that, but you know, it's crazy, man. It's crazy they gonna let a nigga go. But yeah, I gotta get up out of here, man, you know. For this shit, you know, before this shit get took or something, you know. Now look, they might try to put me in the hole or something for this shit. I don't know. But do what y'all gotta do, man. Spread awareness on what's going on to people in prison. Cause this shit's serious. Hey Dozier, on some 100. Like, do me that solid, bro. This what they doing to niggas in prison, you feel me? Cause like at the end of the day, we only got drug trying. Like my man Don, I'm about to go back over there and show y'all Don. He on his deathbed. He on his deathbed on some 100 shit. It's different people. But but shit, I'm about to get out of here because they talking about the police coming, so I'm gone. But shit, do that.
Coronavirus is spreading throughout America's state and federal prison systems. I spoke to one man who's serving life inside a California state prison. He asked us to withhold his name because he has a contraband cell phone. He's in one of the facilities where a worker tested positive.
So this is what social distances look like inside a prison. As you can see, I'm filming the day room at the facility that I'm at. And as you can notice, there's a number of inmates freely walking about in the day room. So all it takes is just one person in here to become infected with the coronavirus, and it's a wrap. Everybody's going to be infected.
How in the world is this system going to deal with COVID-19?
All it takes is for one person to come into this environment that's affected, and boom, you got a crisis on your hands. And my biggest concern is it's not so much getting it from the prisoners, it's getting it from the correctional staff.
What are the correctional officers doing when they're coming in? Are they getting checked for fevers?
Well, I've been informed that they are being screened each day that they walk in. This is not one of those things where you can just simply ask if someone has symptoms and clear them to come into work into a dense populated area.
If you started feeling some of the COVID-19 symptoms, how long would it take you to see a doctor?
They have a nurse that's visiting the building every day. The problem with that is, I think for most prisoners, they would be afraid to report that because it automatically is going to result to them being isolated in the hole.
In terms of the commissary, are you able to get Lysol wipes, bleach, anything to disinfect and keep your area clean?
I gotta laugh at that. Are you kidding me? The commissary don't sell nothing but junk food. You hear me? In terms of disinfectant, as a matter of fact, they have a limitation on the number of soap that you can buy.
So how are you supposed to wash your hands as often as we're supposed to wash our hands with just 4 to 6 bars of soap a month?
I think you just answered the question to one of the biggest contradictions. So on paper, it looks good. When you look at what their protocols are for this, they're talking about they're passing out extra soap, that they're doing extra cleaning, that they're passing out disinfectants of this type of and sort. Yeah, that's not the reality in here. This is what's happening right now inside the California Department of Corrections. We're sitting ducks in here.
I reached out to the California Department of Corrections and Rehabilitation. A spokesperson says she cannot answer my questions without knowing which facility the inmate is in, but we agreed to his request to not reveal that information. I then sent more general questions about protocols for the entire prison system, but have not heard back yet.
We need help.
Desperate pleas from behind bars.
Death is imminent for us.
Prisoners in the Alabama correctional system fearing for their lives as the coronavirus pandemic spreads.
It's finna be a mass grave site up in these prisons.
CNN obtained this video from inside state prisons in just the last week, capturing just how deplorable conditions are in the facilities. The State Department of Corrections, in an internal document obtained by AL.com, sounding the alarm. Quote, 21,900 inmates being housed in crowded dormitories creates a very high exposure risk situation.
They are not giving us hand sanitizer. They're not giving us proper soap. They're not giving us masks.
Inmates crammed together, overflowing in some spaces.
We're stupid crowded, we're super crowded, and it's super dangerous with the coronavirus.
Alabama state prisons are among the most crowded in the country, according to the Bureau of Justice Statistics. And the Justice Department found the 13 major facilities in the state were 182% past capacity, one even at 3 times capacity.
ADOC here, there has no preventive measures to stop coronavirus from coming in. And by the prison being so overcrowded, once it's in this prison, it will flood like wildfire.
Almost no testing of prisoners has been done. The internal Alabama Department of Corrections document reveals that in the worst case scenario, nearly 200 inmates could die, given that conditions will, quote, accelerate the transmission of disease among the inmate population as well as the Alabama Department of Corrections staff. Social or physical distancing is not an option.
Let you on that again? That's how close we are.
And while some states and Attorney General Bill Barr have released some inmates early to help mitigate the oncoming disaster, Alabama, for the most part, has not.
See, these are the people that they should be letting go due to the coronavirus. What in the world can this man do?
The Alabama Department of Corrections gave us no specific response to our story, directing us to their website detailing their response to the outbreak in general, which says in part, quote, rest assured that all inmates in our custody will continue to be provided with the services to which they are entitled, including rehabilitative, medical, dental, and mental health through the duration of the COVID-19 outbreak. A response seemingly from a world unlike the one where prisoners say they do not even have basic hygiene needs met.
You ain't bring no hand sanitizer with you?
Ain't none.
Ain't none.
Ain't got no more. The sinks are very outdated. We cannot wash our hands simultaneously at the same time, you know.
Leading these inmates to risk retaliation to publicly beg you right now.
Hit the like button and subscribe. I need you to hit the like button so it can register on YouTube algorithm. That's why I don't monetize it. All I need you to do, again, if you enjoy this free content, this free information, and you leave here smarter, which is my intention, then go ahead and hit the like button and share.
We need help.
And forcing these men to potentially face a horrific fate no judge or jury sentenced them to.
It is a death sentence. Death is imminent for those in my age category.
Meanwhile, a prisoner at Rikers Island in New York has died of complications from COVID-19. Hundreds of prisoners and prison workers at jails across the city have tested positive as calls mount to release more prisoners in order to stem the spread of the coronavirus. Data is emerging showing major racial disparities in coronavirus death rates across the country. In Chicago, 70% of COVID-19 fatalities have been black residents, despite making up less than 30% of the population. In New York City, coronavirus patients from the Bronx, which has large Black and Latinx populations, are twice as likely to die from the infection as elsewhere in the city. City and public health officials say the disproportionately higher rate is due to a greater number of underlying health conditions such as diabetes and asthma, lack of access to testing and health care, and poor conditions in public housing that promote the spread of the disease. New Orleans, a majority Black city, now has the highest coronavirus death rate in the entire country. In Europe.
This channel is dedicated to bringing truth to power and engaging our enemy with intellectual warfare. The dominant society will never switch up their playbook, so we must make a new one. The war we find ourselves in is a technological war, using technology, propaganda, and psyops to oppress and control you. Black intelligentsia, please share the new black media, counter propaganda arms, make it plain TV.